Does your doctor know what supplements you're taking? Some supplements may restrict how effective your prescriptions work. Pharmacist Timothy Tyler explains the importance of working with your doctor and knowing what your medications and supplements do for you.
My biggest concern probably with supplements and medication is that patients don't assume that supplements are real. It's not real, it's not a medication. Well, the body doesn't know the difference, so why are you downgrading it to the point where it's not important? It may be important if it interferes with or even helps or hurts the medication. All of a sudden it's very important to me, and it's going to be very important to the patient. If your doctor's trying to make an informed decision, they're only seeing half the picture. They're probably not going to make the best decision for you, especially when something may be fighting a medication. When the physician or when a medical assistant or a nurse is asking you, hey, can I have a list of your medications? We'd like to update it. Make sure you volunteer also, oh, and I'm taking this supplement and this supplement. We do want to get the most accurate picture of the medications that people are on. Something simple like I take a lot of vitamin C. That can change the acid-base profile in your urine excretion. And so if you had something that was going on and maybe your doctor is trying to follow that up, it would be helpful to know that you take more than the recommended daily allotment of vitamin C, just so they're like, okay, well, let's stop that, we'll repeat the test, sure, it's normal, great. So there are things that can actually change outcomes, but the physician and the team need to know.
Dr. Tyler discusses why it's a bad idea to take expired medications.
Very few medications turn toxic after they expire, but there are some, so you need to be careful. But when a medication expires, it's basically when the FDA has said, doing the best rocket science the drug company has at its availability, at its resources, to try and figure out when the drug is going to be at 90% efficacy. Once it drops below 90%, the FDA goes, no, you're not really getting what you think you're getting. So that's when an expiration date. Now, you may notice an expiration date is a year, it may be 2 or 3 years out, it may be 6 months, it may be, So again, they do vary, and again, it's based on a best guess when under normal conditions. Conditions of storage also play a part. So if it's not kept at controlled room temperature, that could degrade faster. Where do people store medication? In their medicine cabinet, which is probably the worst place. It's in a bathroom where you're continually getting humidity. So a cool, dry place is where you really should store your meds to get the maximum shelf life out of them. But really, it's the best guess of when it's going to be less effective. And so really, if you're hoping to get the best out of it, you want to take it up to that point and then discard it appropriately.
Patients need to know why they're taking a medication.
Well, I think in order for patients to be empowered, they need to understand why they're taking something. What we've found over the years is that patients are their own best advocates. So it's in your best interest to say, hey, why am I taking this? Or do I need to take this? Do I need to take all of this? What do you mean all of this? Well, I'm also taking this for that same thing. You are? We don't have that in your record. Well, now you could have very easily now been double dealing and doing two things. Possibly two things that are fighting each other. It's bad enough when you're taking one medication that's not effective, but if you're taking one that's now competing with another medication, chances are you're not really getting any relief for whatever it was you were trying to take them for. So it's very important for that patient to be the receptacle of all knowledge, to really be their own best advocate, to say, why am I adding this in? I already take something for whatever they're prescribing it for. Maybe it's kidneys or heart or blood pressure, whatever. And then it's up to that clinician to say, oh, well, I know that. The one isn't doing it. These two work together, they don't fight each other. And so it's okay. However, I am worried about X and thus and such side effects, so that then the patient knows, okay, if that starts going off the rails, I know I have to come back and say, look, I know we tried this, but you were worried about the side effect. Well, I'm having that side effect in spades and I don't want to. Or I'm not willing to put up with that. So which one of these do we get rid of, or is there another alternative? Is there a dose reduction? But I find too many patients are very passive. Well, the doctor wouldn't do anything No, the doctor intentionally wouldn't. Neither would the pharmacist, neither would the nurse. But the whole point is nobody's really focusing 110% on you unless you are.